Hello, good afternoon, good evening, everyone. Welcome, welcome. My name is Harpreet Gujral. I'm a nurse practitioner here at Rose Wellness. And today we'll be talking about mold, unmasking mold, the overlooked root for chronic symptoms. I will share my screen. So I know this topic is very near and dear to me since I have been touched by this particular condition and I have seen multiple patients over the years. And so today we will talk about how mold has been the overlooked root cause of some chronic symptoms. This is not about creating more fear, it's really creating clarity. It's figuring out how to help people understand how mold can be considered sometimes in the health picture. So today we'll go over objectives, which is to understand how mold exposure can affect multiple systems, including our brain, immune system, etc. It also to recognize what are the common symptoms people can experience from mold or from mycotoxin exposure. I'll explain what mold and mycotoxin means, and we'll look at how mold illness can actually be frequently overlooked in conventional medicine. In fact, having been in healthcare for over 30 years, I did not learn about mold in my conventional medicine and conventional health practice. I did not learn that during my doctorate degree, during my bachelor's or master's degree. We did not, it was not covered in syllabus. So this was out of my functional medicine training and really going after understanding what mold is over the last few years and having my own personal journey has led me to become very passionate about this. So today we'll talk also about how to be more clear about mold-related illness needs to be properly evaluated through functional medicine lens and practically figuring out how what first steps need to be taken if mold exposure is suspected, and how can we make mold toxin illness not chronic. So we know that mycotoxins are actually toxins, compounds made by mold. These toxins are made for self-preservation, for keeping mold protected from other organisms, other molds, etc. And these mycotoxins can actually become airborne in dust or spores, and that can contaminate our food supply and also surfaces. It can also enter our body through inhalation. We can ingest it, or it can come in contact with our skin. These mycotoxins, the toxins that are produced by mold, can actually interfere with our immune system. They can create inflammation through affecting our inflammatory pathways. They can also affect, creating a lot of fatigue by affecting our mitochondria, which are the cells that help create and produce energy. It also can cause neurological dysfunction, and I'll go into symptoms in more detail in next few slides. So remembering that mold toxins are invisible, and a lot of times they cannot be smelled, seen, and yet they're present. So it's really important for us to include that in our diagnosis, differential diagnosis, and see if this exists in a person's condition. So what is mold? Mold is a type of fungus that thrives in moist environment. We know that, we've seen mold like on a tree. I'm looking outside the window and there's a tree with the mold on it. That's not necessarily what we're talking about. Molds, there are specific mold that can actually grow in areas where there's water damage, poor ventilation, persistent humidity, and organic building materials that are exposed to humidity. So generally, we can see that it's in basements, bathrooms, kitchens, underneath the drywall, below the drywall, also in HVAC systems. It can also, a lot of times when people are having strange symptoms, we may not include mold in the differential diagnosis. However, as I mentioned, even though we don't study this in conventional medicine, there is a gap in the framework. So it's not that conventional medicine is trying to keep this hidden. It's just that conventional medicine, looks at single organ disease, and mold creates multi-organ dysfunction. So there is environmental exposure, which we don't ask people. Generally, we don't ask where they live, what kind of environment they might be exposed to. We look at their standard labs and everything looks normal. So we say, well, your labs are looking good and there's nothing wrong with you. And that is not okay, because normal labs do not mean that the person does not have an illness, or their health is, in up tip-top condition. So, a lot of times when I've seen my patients who've said, you know what, I've done everything right. I am not feeling right. My labs are good. I've been told I've been to 6 or 7 practitioners, and I was told that, I'm exercising, I'm eating well. I need to manage my stress better so I can have more energy. But I am not well. There is something not right about what's going on. And this is not how I've been over the years. People can feel fatigued. They feel, some people can gain weight. It just feels very inflamed on the inside. You just feel puffy on the inside, even though you're told you're not puffy, you're fine. And so the question is, what is that something in our environment that is being missed? And so when we look at these symptom patterns, we're looking at what is happening in the body. So this person will notice that they're having brain fog, they're having cognitive issues, their mood is changed, they might have anxiety, they might have headaches or some dizziness, and their blood pressure is fine. They might notice inflammation, they might feel puffy, as I mentioned, on the outside, on the inside, but they look normal. Their gut, could have dysbiosis. They have issues with digestive issue, like problems, bloating, acid reflux. They just notice that certain foods don't feel right, or they might have runny nose after eating certain foods, which is mast cell activation. They might have hormone issues. So both men and women might experience that there are hormonal imbalances. Uh, Women might skip periods or have heavy periods or just have dysregulated periods, etc. And as I mentioned with mitochondria, how mold can affect our mitochondria, we might have low energy. We notice there is cellular dysfunction. We might have nerve pain. So a lot of times people will say, I feel this shooting pain in my leg or my arm, and it just disappears. It goes away. I've seen a neurologist. I've had MRIs or CT scan, and everything was normal. But I don't. I am sensing this. It's happening to me. They might have insomnia. They might have sleep issues. They wake up tired. And when we look at these symptom patterns, what we notice is that, as I mentioned, it is specific, systems that are being affected. And in this picture that you see, the healthy gut, where you see all these cell wall, cells are joined together. There is no gap per se, and stuff that is, healthy gut. So intracellular transportation is happening very, in a healthy way. There is no things that are not to be passed through, do not pass through. And however, with the leaky gut, these cells have come apart. They are no longer joined together, and there is this leaky guts where things are sliding through between the cells. They're going through, and this intestinal content, even though it's microscopic, The mucosal layer has also been affected or damaged. So there's interintestinal content that passes through, and people can actually start to have antigens where we know that 60% of our immune system resides in the gut. And so when we have leaky gut, things are passing through that are not supposed to pass, and our immune system starts tagging that. And whereby, we might have thyroid antibodies, get elevated. We might have some skin issues. We might have, eczema, bloating, our periods are off, mood is off, you're feeling irritable, we're tired, waking up in the morning, you're just ready to go back to bed, and the brain fog. And you're like, what's wrong? Because all of my tests are fine. I've been told everything is okay, but why am I not feeling all right? So, we call mold the master masquerader because it can mimic a lot of other things. It can look like allergies, which a lot of times my patients have been, saying that they have sinus issues for many, many years. This is something they've always dealt with, and they've considered that as their normal, natural part of who they are. They can have asthma. However, when you do their peak flow or even PFTs, your pulmonary function test, it comes back normal, but they are labeled as having asthma. They can have chronic sinusitis. They can have irritable bowel syndromes, constipation versus diarrhea. They can have hormone imbalances, anxiety, fatigue-like symptoms. They just, and sometimes in conventional medicine, because if we don't see it, we don't understand it, we might say to you, everything is really all right. And our patients are gaslit, even though it's not the intention of healthcare providers. But if you're not fitting the diagnostics, of what we've been taught in conventional medicine, we're not sure how to help you because we don't even know what's wrong with you. And that is very frustrating. So, our goal is to really provide clarity so you can better understand your symptoms, so you can really take the next steps of, figuring out, evaluating what exactly is going on. Now, why do some people get affected by mold and others don't? For example, in the same family where there has been a leak, let's say in the basement, and there's just one person or maybe two people who are not feeling well, and everybody else is doing okay. So, so then it's like, okay, what's wrong with you? Like, we had the mold, we cleared it, it was cleared, and why aren't you well? But everybody else is okay at home. So what happens is each one of us have different capacity to detoxify. And this is a genetic variability. We can actually have also specific resilience, in terms of immune system. We can have our hormonal balance. For example, how efficient is the liver in detoxifying, in maintaining the hormones to be balanced? Mitochondrial health. So what is the baseline of this person in terms of their mitochondrial health? Is this someone who is very active, athletic, etc., and then suddenly they were exposed to mold and they weren't able to clear it? And what is it happening versus someone who was just average person like you and I, and they've felt like progressively they just are able to do a little less and less and less. I used to be someone who just could not even walk on treadmill for 5 minutes. I was so short of breath. It was really hard for me. I had gained weight. I just didn't know what was going on every day. Woke up and I was tired and I could go back to bed. And it also happens when we have toxic burden. So if there is specific, pre-existing toxins already, the body's not able to clear mold. And so all these symptoms and, susceptibility, preponderance to being stuck with mold really affects different people differently. And in addition to chronic stress can be huge. And it's really important to make sure that we are intentional about releasing stress by taking care of it. We shouldn't just normalize and say, well, we live in this area and there's a lot of stress in here. Obviously, yes, there is, but what are you doing every day to mitigate the stress so we're not affecting our immune system. So why mold can go undiagnosed or treated, not treated? Well, for example, as I mentioned, there is multiple body systems. So I'm repeating this because it is pretty complex, and this just hits home for those who are like, oh my God, yeah, that's me. For example, some people can have brain fog and fatigue, or they can have sinus symptoms and digestive symptoms, or they can have skin issues and digestive issues. They can have anxiety and hormone problems. They can have joint issues. A lot of times I've had actually patients who were told that they had arthritis, rheumatoid negative RA, and because they could not find the blood test was negative, but they had all the issues, all the symptoms that looked like arthritis because of mold. It was affecting their joints. And people can have chemical sensitivity where they might notice that a lot of different foods are no longer agreeing with them. They're having a lot of allergies to different things now. They are become more sensitive to skincare products, to home, health, home products, cosmetics, laundry detergent, etc. And they're just having to be more conscientious even outside when they're eating, and what can affect them, perfumes, etc. So when symptoms of appear across different systems, we know that there is something else going on, and there is an inflammatory trigger. So this is a paper that was published about chronic illness is associated with mold and mycotoxins. Is nasosinus fungal biofilm the culprit? And here they talked about how we can have these biofilms. These are little igloos that are being formed by affecting bacteria, viruses, mold, and it makes home in our own bodies, and it stays protected because it's formed this igloo, this mesh of protective film, and it lives inside, residing without being, tagged by our immune system, without being cleared. So that can really affect people for years to come. How do we get mold expo? How do we get mold? Well, indoor, as I mentioned, water damaged homes. It can be at schools and home, offices. I would see people who, the kids were fine during summer. They went back to school and they just started not feeling well. August, September came, October, they're not functioning, they're not able to keep up with their homework, they're feeling sick, they're getting more infections, they're coming home just not feeling well, they're not able to concentrate on their homework, etc. So it's like as longer the months go into the session, this new classroom, new school where they're being exposed to mold, not every child is going to have that same effect. As we saw, there are some humans that have more preponderance in terms of how they're, reacting to mold. So, food sources wise, and this is why, we ask people to actually eat organic, if you're eating meats and chicken, fish, eggs, etc. If the animal feed and livestock products, if the animals were fed moldy feed, they can have mold in their system. And when we eat those animal products, we can also consume mold, which can become part of us. So it's really essential to, when possible, to eat clean, to eat organic. It can be in contaminated grains, corn, nuts. It can be in coffee. It can be in spices, etc. So really important to pay attention to that. In occupational settings, agriculture, people who have barns, are love, horses, they're around horses, taking care of them, feeding them barn. They can be exposed to mold as well. Construction workers, people who are actually in the water damaged workplaces. I've taken care of people who actually help remediate mold, but then at some point they've gotten a little bit more complacent and they haven't worn their mask while they were in those settings, and they've actually been exposed to mold themselves, and and have these symptoms that we talked about earlier. So it's really important to look at a variety of different risk factors where we might be getting mold. This could be uh, a beach house that a family goes to for 7 days. Everybody else is fine except for this one person who got exposed to mold, and it's really affected them. And they can come back and just not feel well, and actually never think about what had happened. Was that beach house a place where that was, a concern? So mold exposure is a growing public health issue. However, it's not really talked about. We know that indoor environments can actually have a diverse amount of fungal species like Stachybotrys, Aspergillus, Penicillium, Chaetomium, and Fusarium. And there could be small numbers, there could be large numbers of these mold toxins in the indoor environment. And they can cause significant biological effects even at low concentration. For example, Stachybotrys, black mold can actually be and I'll share with you testing, and I'll show you how that report shows that even small amounts like 0.07 parts per million, a billion, can actually still affect a human immune system. It can affect us in how we are feeling. It can cause respiratory problems, neurological symptoms, mood and immune system dysregulation, inflammatory syndrome, etc. And it's often overlooked because, as I mentioned, we weren't taught. We don't have routine medical testing that looks at mold testing. We look at organics, organ specific. We look at infection markers. We look at your, structural abnormalities, but mold is none of those. So it's really important to get a detailed environmental history, symptom pattern recognition. We figure out what is happening. We're listening for that specific history, and actually, getting it out of the patient as they're describing when did they start noticing these symptoms, etc. And then getting specialized laboratory testing to check for what else is going on. And so it's really important to look at that pattern, and also detailed environmental history is absolutely important to look for potential exposure. How we evaluate, as I mentioned, is clinical and functional approach. We get a detailed environmental history. We're looking at your symptom pattern recognition. We're looking at physical exam. We're checking for specifically for mycotoxins. This is a urine test. We look at your gut health because remember, there are some people who are fine while others get sick. So why did this person get sick? Well, did they have gut issues? Did they have hormone problems to begin with? Did they have mitochondria problems, issues to begin with that actually predisposed them and made them more vulnerable to getting mold, mold condition. So it's a process. It's looking at all of that versus just looking at one test. It's really about gathering this, as an investigator, this comprehensive information to figure out what is going on. So, as I mentioned, we do mycotoxin urine testing. We check for immune and inflammatory markers. We, if needed, look at gut health assessment. There are specific, very elaborate, comprehensive gut assessment, which is a stool test that looks at commensal bacteria, looks at bad guys, the parasites, the opportunistic infections, looks at inflammation markers, looks at, what is happening with the immune system there in the gut, etc. Looks at nutrition deficiencies. It looks at detoxification markers. We also check, if necessary, hormone testing to really see if there is a coexisting. So it doesn't mean that someone has mold, they don't have anything else. They could still have other conditions. And by doing a comprehensive testing, we actually are able to parse out and see what is present and start working, get busy and start working on each of those aspects. And there is a specific, way of how that is done. So we look at testing, we look at symptoms, we look at environmental exposure history. This is an example of a sample test of mycotoxins. It's done by this company called Real Time Laboratory. And what it does is it actually looks at, as I mentioned, ochratoxin. So these are different toxins that are ochratoxin, aflatoxin, trichothecene, gliotoxin, zearalenone. So these are five different toxins that are looked at. And as I mentioned, it is calculated as parts per billion. So, there is a normal, expected, understood, range, and then there is range that's above that, equivocal range. Now, what happens is when people have mold issues, their detoxification processes are likely not optimized. And so, even if someone has mold, when they get the test done, they may not show as high of numbers. So we actually have people, get the test done. We have them prep before they get the test done, specifically to make sure that their test is more accurate. And it's not affected by their lack of, being efficient detoxifiers. And as you can see, this trichothecene, where 0.07 parts per billion, between 0.07 to 0.09 is considered equivocal, but anything above that is considered um, is considered elevated. So it could be so tiny, parts per billion, 0.09 parts per billion, and yet it can cause multiple systems issues. Same thing with gliotoxins, zearalenone. The next thing we see is like this is a graphical. So this is like over time. This person had their test done over multiple times, and it shows that the blue line is where it was not detected. So ochratoxins were not detected, yet aflatoxin, which is in food, they were able to find that once, even though initially it was below the range, once the detoxification process was improved and they were able to get rid of things much better, we saw this number elevated. And once they continued to treat, they were able to bring that down to almost to undetectable levels. So trichothecene, same thing, almost undetectable levels with treatment. So this is how over time we're able to check mycotoxin, get a baseline, and then periodically assess to see what they're doing, and then tweaking the treatment according to how the patient is doing symptoms wise and what is happening with the mycotoxin report. This is a sample of gut testing. As I was mentioning, people can actually have things that are happening in their gut. So they already have pre-existing inflammation. They have dysbiosis, so these are bacterial pathogens that are actually just sitting around in the gut. So this was a stool sample that was collected, and it showed that there was C. diff that was producing toxin A and toxin B. It actually showed that they have Shigella-like toxin also. Commensal bacteria are the good guys. We want to see what is the balance between good guys and bad guys. These, as you know, about 3 pounds worth of a gut microbiome. So in fact, we actually have more genetic material that belongs to the gut microbiome, the bugs, than our own genetic material. So they're there to help serve us, help produce raw materials for our body's function, etc. So really important to have healthy dose of the good guys, the keystone bacteria. So we go through this report very, very comprehensively with our patients and figure out if there is something that needs to be addressed. So really looking at root cause analysis, making sure that we are addressing, the foundational health, not just putting band-aids and getting somebody, just some binders and getting them, helping them to get rid of their mold. Like that's not how mold is being treated. You don't just take binders and call it a day. So another sample testing, we do is to look at hormones. We look at your cortisol production. We look at adrenals. We're looking to see how stressed is someone, how is their adrenal gland doing, what kind of DHE and cortisol they're producing, and that it can give us a very helpful information about their cortisol levels. We look at these graphs and see how they compare to other population, etc. And so really helping enhance that, not just getting rid of mold, but actually optimizing health by looking at these foundational pillars of health. So we look at how to restore the HPA axis. We are figuring out what is happening with the cortisol rhythm. We help adrenals recover. We balance their thyroid if needed and check for insulin pathways, and then rebuild energy by building up the mitochondria and building the body's resilience to do so. So it's a very systematic approach to look at all of those things to make sure that, we're um, looking at this, very foundationally. Now, how might someone prevent this, right? Well, there are a few things, and these are very important. So a lot of times, if leaks happen, for example, if you're in a rental property or, you're an owner and you're so busy, you called for, someone to come and fix it, but they're taking their sweet time and they haven't been by. This can actually, get into into the building materials, and that can actually cause, more water damage. We also need to make sure that our now summertime is coming. We want the indoor humidity below 50%, really important. So getting a dehumidifier, especially in the basement, especially in the areas where there are areas that have a lot of humidity, ensuring that there is proper ventilation, making sure that we replace and clean water damaged materials, which should not be done by us ourselves. Always making sure that we have professionals managing that, especially those who are sensitive, to mold, etc. You should never be doing this, on your own, especially if you're not in a protective garb. It can increase your exposure to mold and can really create problems. And in fact, if someone was using, for example, bleach or something to get rid of mold, mold recognizes that as a threat, and then it produces even more toxins, to protect itself, and that can be really harmful for us. So really making sure that we are using, professionals who are trained in inspecting the basements, and looking at crawl spaces and are able to do a, comprehensive assessment. So how we help people recover is first identify and reduce the ongoing exposure. We help improve their detox pathways. We reduce systemic inflammation. We look at, evaluation, restore their gut and immune balance, make sure their mitochondrial energy is improved, and through improved detoxification pathways, they're able to, get rid of toxins, so that mold is the next thing that's able to also detoxify when we become more efficient, and we have more energy to then take care of things that need to be done. So as I mentioned, there are things that can actually create backfire. For example, if we start detoxing someone very aggressively, we're like, okay, less is, more is better. And, if so, dose is the key that makes poison versus medicine. So if the body's already overwhelmed with inflammation and stress, you can't just put in more binders and just let them, get treated for mold. It has to be very systemic. It has to be gentle approaches. It has to be very intentional, very well thought out, because we must help open slowly their detox pathways. We need to help the liver, gut, lymph, and kidneys to really optimize their functioning. It's through gentle sauna, it's through gentle approach, opening up, those pathways through supplements, etc. And then, sometimes people might do aggressive detox. That can actually cause a lot of toxins to just bottleneck. They come out of fat cells, they come out of the system, and now they're bottlenecked and they're not able to be removed and released, and the person can actually get very sick. They can actually have fever-like symptoms. They can actually feel very, very sick, fatigue, headaches, feeling very ill, etc. So it's really important to, seek medical attention to make sure that we are, in the hands of people who understand this, and and are going to use the approach that is much safer, by building the foundational health. So a lot of times people feel like this is an on-off switch, and it's not. It is a dimmer switch. It slowly is moving up. So we build on foundational sleep, we fix the gut, we work on nutrition. We want to make sure that they're receiving adequate nutrition, making sure they're having daily bowel movements, calming the nervous system, because as you know, when there is mold and mold toxin, nervous system is hyper active, and we can actually feel anxious and feel very restless. And so the specific calming has to be done for the nervous system. We start with detox very slowly and gently, and support people to slowly work as the body is getting acclimated to this and is tolerating this better, is when we slowly, are able to increase those efforts. So, for example, this young lady, 51 years old, came to us with persistent fatigue. She had a lot of brain fog. She was having sinus issues. She said this has been happening for a while. She wasn't able to lose weight. She was noticing she was getting tired. Her labs looked overall okay when she came. So we obtained an environmental history, and we found, listening, because we were listening for this, we found out that there was an exposure, that she was previously exposed to mold. And when we did the functional testing, we were able to find mold in the real-time laboratories. It took a while, it took several months, and that's how long it takes. We have to be really patient. As I mentioned, it is not a sprint, it's a marathon. So really working, and trusting the process. And the approach is to really, figure out where the exposure is, making sure we're not ongoing, persistently being exposed. We reduce that. And then working on gut and immune health, working on gradual detoxification support, and helping the nervous system to be regulated so the body and mind is able to, start to heal. And then we started to see for her, her energy was better. She was able to exercise. She had less and less brain fog. She was able to concentrate. She was very embarrassed previously because of her brain fog. She wasn't able to remember names. She wasn't able to have good memory at work place, and it was really very embarrassing for her. So as we worked over several months to lower that toxic burden, really build her gut, health, she was able to be herself again. She felt, she was sharp. She was able to, get her work done, feel more resilient. And that's precious when we can just be ourselves and not have to, put up with, proving that there's something wrong with us, and that we need, some sort of testing and treatment. So, as I mentioned, she actually felt energized. She was more clear. Her sinus congestion disappeared. It actually improved over several months by, us treating her with multiple different types, and the digestive system got better. Her skin got clearer, and we were able to help with the hormone balancing, because she was also in perimenopausal state. So all this is happening, and you have to tease it out, like what all is happening, and then, bit by bit working on each of those systems. So key takeaways today are: mold exposure can impact multiple body systems. Symptoms can appear related or unrelated, but they follow patterns. Traditional testing may not capture environmental contributors. It may not capture, mold testing is not part of traditional testing. And thus, proper evaluation really is needed for us to have a broader clinical lens. We know that recovery is possible. We know it is possible. We must have structured, personalized approach that's tailored specifically to the person, and not just some cookie cutter. This is what we do. This is how we do the binders, etc. It's really about understanding where is this person coming from, what is their baseline, how healthy are they, and then systematically working on each of those layers and helping. So So a person doesn't have to do this alone. They can have a whole team that supports them, and they have the regular, the proper testing that actually is able to figure out what is going on. And I think that is crucial. I'm really grateful that I was able to, get that kind of help. I was able to, in fact, um, I just sent my, I had sent the test, the urine test, because I was learning about mold many years ago, and I was like, oh, let me send this test. And sure enough, my mold was mycotoxins were present, and that's when I learned, no matter, no surprise that I was feeling tired, I was having all those symptoms, and then once we were able to treat, mycotoxins and mold, I was able to get more clear, lose some of that extra weight, and get my hormones in better balance. So I urge, if you know someone who's going through similar symptoms or issues, please have them contact our office. We can see you in office. We can do telehealth. We are in different states. We can see you in New Jersey, in Virginia, DC, Maryland. But anyways, the best way to do is just call us at 833-767-3935, and speak with you have a free consult with our wellness coordinator who will guide you and let you know if this is a good fit. If we can help you, support you, we will love to do that, to help you through your health journey. And with that, thank you so much for your time. I really appreciate your time and attention, and have a nice day. Thank you.